Hi, welcome back. We're talking about housing and homelessness in the region of Waterloo. We have Tracy Collins, nurse practitioner at the psychiatric outreach program and at the Working Center, and Jennifer Maines as well, coordinator of outreach programs at the Working Center. So welcome both of you. Thank you very much for your time. As we've mentioned, the theme here for this year was housing and health and how they are related. So Jennifer, if you can start by just letting us know what is the tie there between housing and homelessness?
Well, housing is one of the primary assets that one has to have if one is going to have good health. So it's essential. It's a prerequisite for good health.
Sure. And so how are people, Tracy, if you can answer this, how are people affected then, you know, in every way, emotionally, physically, psychologically, if they don't have that proper home to go home to?
Well, if I took a look at that from a health perspective, it's imagine if you came to see me because you had high blood pressure or you had headaches or something. Yeah. And I said, okay, well, here's what we can do. You'll need to get this medication. I'm going to have to refer you to a specialist. And how are we going to be able to get a hold of you? What's your address? Well, I have no fixed address. How about a phone number? I don't have a phone.
Even a car to get around to the appointments, right? Or money to ride the bus, or?
Yes.
Okay.
And, you know, I'm not going to be able to eat that low salt diet because I'm trying to get onto Ontario Works, and I get $570 a month from them. Yeah. But if I find a place, it would be about $400 a month. And then my bus pass would be $50. And when you start doing the math,
again, like we've been talking about, yeah, it doesn't add up, right? Oh, go ahead.
$400 a month it's hard to find a decent place for $400 a month.
Yeah.
So one bedroom bachelor $600 is difficult to find. So then you're looking at subgrade housing, which Michael mentioned earlier, which is part of the problem for many people.
Yeah. And what are some of the things you're hearing from your clients in this regard when they're talking to you or you're talking to them, and just kind of their hopes and their issues and things that they're facing on a daily basis?
Well, not having enough funds to get the proper housing. And then, of course, as Michael alluded to earlier, there aren't enough housing that's adequate. There isn't enough housing that's adequate for people. So when you're looking at not enough and not enough housing, not enough money, that creates great stress for people. So they're not able to cope often with what they're dealing with. There's a lot of rooming houses that many of the people that we work with, because we work with a lot of people who are homeless or at risk of homelessness. Rooming houses are often the only resort for people, which again are crowded, noisy.
So still not an ideal then situation.
Definitely not ideal.
Yeah.
No.
I hear quite often some of the people that are in rooming houses will say they're trying to get off of a drug habit, and the rooming houses, they can only get a place in that might be a crack house that they can afford, and so they relapse into use of drugs. So that complicates their health as well. Yeah. They get robbed on the street. Their OHIP card, their healthcare card, may get taken away from them, so now they can't go into the urgent care. They may be in a community health center setting where it's a rostered. It's like a family practice, so they can't walk in as I could to an urgent care. Yeah. And then they end up in a merge, but it's not technically an emergency, that what their health issue is, but we need to do some prevention here so that it doesn't end up an emergency. And if it's a mental health issue and they're not on medication and can't afford medication, then eventually there may be some loss of insight.
And it's just a cycle, right? Like just a vicious cycle that just continues, and it sounds like once it starts, and once it gets bad and worse, I mean, of course there's things you can do about it, but by that time,
there's not, I'd like to say there's not a lot of flexibility about what you can do about it. When you're at that low level of income, I'm not sure what people think. Like, people have often an impression that if you pull up your bootstraps, you really try hard. I'd say people are in a glass ceiling, that there's not a lot of room to do any pulling for anything. Yeah. So the ability to change one's circumstances are quite difficult.
No, of course, understandable, especially when when we as Canadians, we think of our basic needs as, of course, a house, right? A place to live, and of course, healthcare. And when we hear about how the two are really linked and affect each other, you realize that that's not almost a luxury that everybody has. What do you think needs to be done? And I know that's a loaded question, and we could sit here all night, but what are some of the steps that can be taken to alleviate this?
If we could, now we're looking at the federal government and provincial government also. So the region has done a wonderful job trying to find ways and asking agencies involved with people who are dealing with this situation, how do you flex, how do you move, how do you change things so that we can accommodate it? But basically, if there's not enough money, there's only so much one can do. So some of the solutions have been a guaranteed income, which would make a big difference. Another one has been allowing people to have bus passes, free bus passes if you're on Ontario Works or on Ontario Disabilities. Those would make a big difference in terms of people having, even physically gaining access to the healthcare services that they need. Often the hospitals are the only recourse for people, and although we're trying to eliminate inappropriate ED use, if we can't support people in a way that allows them to gain access to their family physicians,
then where else can they go, right? And that's exactly it.
Family physicians are also a difficulty. There aren't enough. So we're at a bit of a
Tracy, what do you think?
Well, I also think that sometimes we don't see things as they are. We tend to see things as we are.
Okay.
So by that I mean, I had a conversation with someone recently who said, how hard is it to do the lifestyle modifications for type 2 diabetes with hypertension? And I said, well, let's take a look at that. So what do you need? Let's itemize it. How much does your rent cost? How much does your car insurance cost? How much does your medicine cost? Etc. So anyway, the number ended up coming out to about $1,500 a month. Your gym, how much does your gym membership cost? And I said, and then how do I do that if I'm on disability and I get $970 a month rent? That's my monthly premium, and $600 a month is in rent. What do I cut back in my lifestyle modifications?
Wow. And I mean, when you put numbers like that, nothing, right? There's literally nothing else when you barely have anything that you can cut back. Thank you both for your time. Unfortunately, we are wrapping up this segment, but do appreciate it. Tracy and Jennifer, thank you very much for your time tonight. Do stay with us as well. As I said, we have a great lineup of guests. We are talking about the 5th annual report card released by HUG. We're talking about housing and homelessness in the region of Waterloo, grade of -C. What do you think? 519-893-6905. We'll be back right after this. Hi, welcome back. Thanks for watching Talk Local on Rogers TV. We have Sarah Escobar in studio with us, Joe Bauman as well. They're street outreach workers at the Working Center. So welcome, and thank you very much for your time. Welcome back, Sarah.
Thank you.
Always appreciate our repeat guests. So tell us, first of all, what your primary role is as an outreach worker.
So as a street outreach worker, we walk with people who are experiencing homelessness or at risk of experiencing homelessness in the downtown Kitchener.
Okay.
That's pretty much core of what we do.
And what is the goal? What is the hope? The reason behind this?
As street-based outreach, our goal is to be able to build community and to be able to build relationships with people who, for one reason or another, have been isolated and marginalized in our community, and for some reason are not connecting to any other services. So we become that first access point of service for people, and for us that first point is just building relationships and building community with them so that they feel comfortable to come to us when they are ready to ask, or they want somebody to walk with them in wherever their journey's taking them.
Sure, it's crucial. So Joe, how do you find it is to build that rapport and that relationship and that trust with someone?
It just takes time, a lot of time, hanging around, and certain people get to know you, and then the word of mouth, and eventually you have a bit of a reputation.
And they see you and they know, that's a safe person, or that's someone that I can go and talk to. And so what kind of things do they're asking for help? Where do I go? I need a meal, I need a shower. Is that the type of thing? Is it I need to talk,
I think for the most part, the first approaches that we get, and when people do come to us, they're very basic needs.
Okay.
So yeah, food, shelter, how do I get a no-hip card, or I need a family doctor, and then it builds up to, I know I need to go to the emergency room, or I know I need some sort of health care, but I don't want to go by myself. the last time I was there, it didn't go so well for whatever reason.
Yeah.
So those negative experiences with any system, whether it's Ontario Works, so whether it's social services, ODSP, hospitals, doctors, if that hasn't gone very well in the past, they're afraid to go back. People are afraid. And it's nice to have someone in your corner. So we become that person. We become that friend, that family member that's missing. You know, we become that aunt, that uncle, that cousin. That's able to just do things with people when they need it.
Okay, and so you go to those appointments, and
a lot of it has to do with just accompanying, being a second set of ears, and just being that person to go with.
And speaking on their behalf as well. Is that something
as
that?
Well, yeah.
You mentioned earlier these are people who are homeless or at risk of homelessness. So I imagine in some cases you could be that point of them at risk to not being homeless. Is that, I mean, are there ever times or cases where you can catch it soon enough?
Yes.
Okay.
Yeah. So and that's where the relationship really comes in. So whether it's that person that you're actually helping, or they have a friend or a neighbor that is at risk, and then we become that access point for that friend or neighbor. So it's not always just necessarily that person that we've been working with and supporting for years sometimes, but it could be a neighbor. And so it's whether they're having trouble with their landlord, or they've gotten a notice that they're going to be cut off OW or ODSP, and they're afraid to call because they don't know what happened. And sometimes all it takes is just a simple call, but they're afraid. They don't know what's going on. Sometimes literacy is an issue. Sometimes mental health issues that people are living with are also issues. Drug use can sometimes become an issue as well. So just helping people navigate the system that for most people can be somewhat easy to navigate.
Or even frustrating for a lot of people too, right? We've all been on the other end of that phone or at that service station and just...
Yeah. Or you think you show up at the passport office and you think you have all your paperwork.
But you don't.
And you don't, right?
No, that's a good point. And it's hard enough for... Go ahead.
Yeah, well, I go to a doctor's appointment with somebody, and that appointment will be followed by 3 more appointments, right? It's like you get your blood work, you get, whatever. And it's too much to remember everything for especially for somebody who's living outside, like moving around.
Yeah, no, you're absolutely right. So do you have any numbers of how many people you work with on maybe a weekly or monthly or a yearly basis?
We currently, there's 3 street outreach workers, Joe, myself, and Ashley, and we have Jess in Cambridge, and we're currently working with about a capacity of about 200 people per outreach worker. So it's tricky because people say if you give A and B, it'll be fixed. C will come about, and it's a lot more difficult than that. And that I think the region is doing well. They are taking the time to come and talk to us. They're taking the time to talk to the people who are experiencing homelessness and have experienced homelessness in the region, and they're really starting to find out what's really in the core.
Okay.
And they're finding out that it's a lot more complicated than just house people or get someone a job, or it's really not that simple.
So are we talking about things like addiction then and mental health issues? Is that at the root, or is it even more than that?
It could be any of those things,
plus
individually,
more.
Combined, plus lots more.
Yeah, community involvement, or just people feeling accepted in their community. I think that's huge too.
It's great to see the community thrive, and you hear of
the tech
companies developing, and our finances are going up, and our average wage is up, and
the average wage is $150,000 in Waterloo,
and the more
right?
successful we become financially as a community, the more isolated you become, and the more you need to be able to do things on your own. And until we get rid of the language and the jokes of the crack house or the crackhead, or laugh at the homeless guy,
or the bum on the street,
or the bum on the street, until as a community we start to shut those down, those beliefs and that way of thinking, I think we have a long way to go. I mean, our government in this region has started to look at it, and they're starting to use better language and more accepting language and caring language. And I think I think that our region has done a good job with that.
But again, still some work to do, right?
Still lots of work to do.
Okay, we are out of time, but thank you so much for yours. Appreciate it. Sarah, Joe, thank you very much. We do appreciate it. We are talking about housing and homelessness in the region of Waterloo. If you'd like to call with a question or a comment, you can, 519-893-6905. We are on Twitter as well, at TalkLocalWR. You can always email the show, talklocal@rogers.com. We're going to take a break, and we'll be back right after this.